This story reflects one person's experience. Not every person will receive the same results. Bear in mind that all surgeries carry risks. This treatment is prescribed by your physician and is not for everyone. Please talk with your doctor and see if it's right for you. Your physician should discuss all potential benefits and risks with you. Important safety information about the X-Stop spacer appears at the end of this video. For additional information about this product and treatment options, please visit www.xstopspacer.com.
By the time these kids came to school at age, 5 years old,
At 76, Joel Handler still leads a very full and active life as a scholar and law professor.
I love my research and writing. That's the heart of my life. But I also really like my students. And I haven't retired because I really love what I'm doing.
He loves the academic life, the life of the mind.
And when Joel is not teaching, he and his wife Betsy travel extensively around the world.
We like to go to places that are culturally interesting. We travel every opportunity we can manage.
I love to be with my wife. We're together all day long, sharing experiences, and that's very nice.
But a few years ago, Joel noticed a nagging back pain that began to take a toll on his busy lifestyle.
You're feeling this pain all the time. It would just steadily increase, and it was hard to get it out of your mind.
Simply standing became unbearable, and before long, Joel had to teach his law class sitting down.
It's not as effective because it's hard to see all the students, but there was just no way I could teach standing up.
It wasn't long before Joel's leg pain had a profound impact on his travels.
I couldn't walk very far without having to sit down and rest for a bit.
One of the places that we really noticed it was going to museums. Maybe every 10 minutes he'd need to sit down.
An exercise enthusiast, even Joel's daily walks along the beach were a struggle.
I was living with it, but I was really beginning to get worried about the future.
I was most concerned that Joel was going to not be able to walk, that this was the beginning of the end, as it were, of life as we had known it.
An MRI revealed that Joel suffered from lumbar spinal stenosis.
Lumbar spinal stenosis is basically narrowing around the nerves that pass through the lower back. As this narrowing occurs, what the patient experiences is pain in the buttocks and the legs because the nerves are being compressed.
Initially, Joel tried over-the-counter medications and epidural steroid injections to relieve the pain.
At first they were effective, but then very rapidly they became less and less effective.
Despite his increasing back pain, Joel refused to even consider a laminectomy.
We are both extremely cautious about invasive medical procedures. It's not the first solution that we jump at.
Professor, how are you?
Dr. Nick Shammy, a spine surgeon with the University of California, Los Angeles, thought Joel would be an excellent candidate for a new innovative device called the X-Stop spacer.
So what the X-Stop does is it keeps the space open in the back of the spine.
The choices for him were either laminectomy or X-Stop. The X-Stop is a less invasive way to treat the stenosis because it relieves the pressure from the nerves.
The X-Stop is implanted between the spinous processes and is designed to keep the space open. So when a patient stands up, their nerves are no longer pinched. And a key benefit for Joel, the X-Stop is a less invasive surgical procedure. In fact, it is often an outpatient procedure. Your surgeon will decide what is best for you. Joel was amazed at how well he felt just a few days after the X-Stop procedure was done.
For me, the X-Stop exceeded all of my expectations.
While Joel received satisfactory results, it's important to note that all spine surgeries carry risks. The X-Stop spacer may not be right for those with certain allergies, spinal anatomy, or severe osteoporosis. Approximately half of patients studied achieved treatment success. It's been nearly a year since Joel had the X-Stop implanted, and he still can't believe the difference it has made in his life.
It was such a rapid, complete transformation from having all this pain to being, totally pain-free in the morning. I mean, it's hard to exaggerate how good that feeling is. And the parents would accompany the child to the drugstore, the grocery store.
Most importantly, Joel is back on his feet, enjoying one of his greatest pleasures in life, teaching.
I think I'm a lot more effective as a teacher now, moving around, making more eye contact with the students.
It's hard to believe when he comes home and tells me that he taught a class for an hour and a half and never sat down.
He and Betsy have taken rigorous trips since the X-Stop was implanted, visiting Cambodia just last year.
The X-Stop has dramatically improved both his and our quality of life.
We'd love to go to museums. I can stand for hours. I'm not exaggerating, I'm talking about hours.
Thanks to the X-Stop, Joel says he has no need to slow down or retire anytime soon.
Psychologically and internally, I'm feeling so happy, feeling so upbeat. I am absolutely, totally pain-free.
For more information, visit xstopspacer.com or call 866-581-2717.